Cervical cancer is the second most prevalent cancer after breast cancer in most women, and also the leading cancer killer of women in Namibia. Current estimates indicate that every year 236 women are diagnosed with cervical cancer and 135 die from the disease. This is according to Japaigo Namibia, a non-profit health organization affiliated with Johns Hopkins Hospital, University, my apologies. Now, Dr. Cornelia Ndifon, who's a technical advisor for cervical cancer prevention, now joins me in the studio with more on her observations. Good morning, doctor. Thank you so much for being here this morning.
Good morning, ma'am, and thank you to NBC for having me.
Absolutely a pleasure. Now, doctor, can you just start by explaining to us what cervical cancer is and what, the known symptoms for cervical cancer are?
Okay. Cervical cancer simply means a cancer that starts or originates from the cervix. And the symptoms include what we call postcoital bleeding. By postcoital, the word post means that the bleeding happens after intercourse, but it actually starts while intercourse is happening. Another symptom is what we call a foul-smelling vaginal discharge.
Yes.
The kind of discharge that you yourself would not feel comfortable, and people around you wouldn't want to be near you. There's also what we call spontaneous intermenstrual bleeding. So menstruation happens once in a cycle. A cycle is 28 days. So when a woman finishes the period, which is usually 2 to 7 days, and then from nowhere, before the next menstruation, she finds that she's bleeding. That is the sign, or those are the signs of cervical cancer.
Now, it's estimated that 236 women are diagnosed with cervical cancer and 135 die from cervical cancer annually. Firstly, do most women have knowledge of the symptoms when it comes to cervical cancer?
Okay, what I can say that the literate women have some form of awareness about cervical cancer. But remember, in Nigeria, in Namibia in particular, I'm also from Nigeria, and the names are related. In Namibia, most of the rural women do not know anything about cervical cancer. And usually nobody sees the cervix anyway, and nobody can tell whether it is cancer happening there or not. So sometimes even when they have these symptoms, they just think it's something else. And because of that, they present late. Although the fault is not all theirs. When they go to the hospital and say, I have this symptom, we just prescribe. And we never take time to look into the cervix and see, is this a normal discharge or is this something that should worry us? Because cancer of any part of the body is not good for anyone. So most people, I can say most women, are not aware of cervical cancer.
Now, Dr. Cornelia, speaking about awareness, I think it's an issue that most women aren't aware of cervical cancer, and you've mentioned as well women in the rural areas. Now, the facilities that are provided for cervical cancer screening and testing, do you believe that there are enough facilities for women, for example, in the rural areas? And if not, what can we do with regards to awareness and then also providing enough facilities for women?
Great question. Right now, the 14 regions of Namibia are providing cervical cancer screening, from clinic to health center to hospitals. I know whatever may be described as a settlement or village may not have a health facility, but I've been to almost every region, and there are some facilities within a walking distance for most women, unless those who live in the farms. And we know that there are huge distances between. So what we've been trying to do is what we are doing now, this campaign, and we need to get on the radio, we need to carry outreaches right to where the women are. In the community, we can put up, tents, we can use school venues, and just campaign and screen at the same time.
Now, Dr. Cornelia, if screening is done and cervical cancer is diagnosed early, can it be cured or prevented?
Fantastic question. So the key word there is early.
Yes.
When we screen, we are actually looking for pre-cancer. Cervical cancer can take between 10 to 20 years in people that are immunocompetent. before it becomes a real cancer. While in people that are not immunocompetent or immunodeficient people like HIV, that duration is shortened. Okay? So with screening, we pick the precancer and we treat it. Now, screening is like saying you are looking for something, you are searching.
Yes.
While you are trying to do screening, you might just find out that, oh, this cervix might already be a cancer. Then you do what we call a biopsy. It might confirm that it is cancer stage 0 or cancer stage 1. And that stage 1 is divided into 1A, 1B. So stage 0, which is like the original cancer. Stage 1A is saying, I'm beginning to move, but it has not left the cervix. Stage 0 and stage 1 are absolutely treatable by surgery.
Now, can you speak to us quickly about the connection between HPV and cervical cancer?
Wonderful. HPV is the virus that initiates the processes that leads to cancer. So you can see that one is the cause, while the other is the effect of infection. Now, when somebody gets infected with HPV virus, it doesn't just overnight become a cancer. It is starting from sexual exposure. Exposure leads to infection. That established infection, with immunocompetency, it can be dealt with. So the body fights and clears the infection. There is no cancer. When the immune system is weak, the body is not able to clear the infection. What do we say? The infection then persists. That persistence damages the cervical cells, causing a mutation in the DNA. And then cancer cells are cells that cannot be controlled. They don't obey any rule. And that is because the DNA, which is the core of the nuclei, is just doing its own thing. And then cancer resolves.
Thank you so much for that. Now, Dr. Cornelia, you spoke about HIV. And I just want us to speak a little bit more, elaborate more on this, because according to the World Health Organization, women living with HIV are 6 times more likely to get cervical cancer as opposed to those without HIV. And also, an estimated 5% of all cervical cancer cases are attributed to HIV. Why is this the case?
Yes, that is very true. You see, HIV multiplies in a manner that I call exponentially. The virus loads the system. What does it attack? CD4. And you must have heard of it. So CD4 is just one component of the immune system, but it is the key one. Now, with that multiplication, you can say that every aspect of the immune system is attacked. I normally use this analogy of ineffective majority. So even if the CD4 count appears good, the numbers, but it's like saying you have soldiers at the war front, some of them without weapons, some of them are crippled, some of them are blind. They are not dead. What can they do? And we found out that even when the patient is on ARVs and is telling you, doctor, I'm taking my medications, a low or undetectable viral load does not prevent cervical cancer.
Thank you so much for that, doctor. Any message, to conclude this interview, that you have for our viewers this morning or for our women this morning, please, ma'am?
I am so passionate about preventing disease. And what you guys are doing now in NBC is great, giving awareness. And I'm asking the women that are listening to me right now, wherever they are, find a day in a week or month, it's just one day, to do the first screening. It doesn't even take long, maximum 10 minutes or 15 minutes because of completing forms and all that. You know, go to the nearest health facility. Most of them are within walking distance, and request to be screened. Look at cervical cancer screening like your human right. Get up from your house, because the doctors and nurses, they are also in their house or in the office. They don't know who is at risk. But now you've heard that women are at risk. Women with HIV are more at risk. please go and get yourself screened. And let us continue to talk about cervical cancer the whole year, not only October month, you know. Let us go on the radio, write in the papers. When we have events, whether we are selling food, somebody should try to put a table or a stand, you know, and talk about cervical cancer. Yes. Let's talk about cervical cancer to women groups in our churches. Let's so much, talk Doctor. In town hall meetings and all that.
Thank you so much, Doctor. Thank you so much for your time. And thank you for making time to come discuss and to make us aware of such an important health issue.
Thank you very much.
I hope you have a blessed day ahead.
And you too.
Thank you so much.
Thank you.
Well, there you have it. That's Dr. Cornelia Ndifon, who's a technical advisor for cervical cancer prevention, speaking to us about cervical cancer and also cervical cancer prevention. Please stay tuned. We'll be right back.